Thank you all for joining me today for my master's internship presentation. My name is Farrah Hermes, and I'm going to teach you all about community impact and digital transformation. For my master's internship, I got to work with the Digital Health Institute for Transformation, also known as DHIT. DHIT is a 501 nonprofit education and research institute founded over 3 years ago by Michael Levy and Lee Phillips. Throughout my time working at DHIT, they have undergone a lot of transformations, and with the core ideals of always being to create a positive impact in communities through enabling digital health. Their main office is in Chapel Hill, North Carolina, right down the street from the university, which allows academic institutions, industry partners, and individuals such as students and entrepreneurs to come together at the office to brainstorm, talk, and discuss ideas. And throughout my time at DHIT, I got to be part of a lot of those conversations. DHIT offers an array of different services and events, such as the digital health happy hours that happen the third Wednesday of every month, going through the whole Triangle area from Raleigh, Chapel Hill, Durham to the Triangle Park itself, and also spreading across to Charlotte, North Carolina. DHIT also has the DHIT Digest, which is a weekly newsletter, the latest digital health news and announcements from DHIT. Most recently, DHIT started a webinar series called the DHIT Frequency, where they get different industry leaders to come together and have early engaging conversations. And what I love most about DHIT is the DHIT Summit. Working at DHIT, I got exposed to different areas of health informatics, including cloud technology, the social determinants of health, digital health platforms, and storytelling. Through these different areas, working at DHIT, I was able to get exposure to all of them and find a way to weave them all together to really amplify my true interest in the healthcare industry. So starting with the DHIT Summit. The DHIT Summit started in 2018 and happens every November in Durham, North Carolina. The DHIT Summit brings together leaders from academia and industry and a startup community to participate in a day-long summit. There are panel discussions with topics ranging from education, quality, research, and community impact to technology showcase where vendors and sponsors can display their latest technology and promote themselves, and also workshops. And to the left, you'll see a picture from the workshop from the summit last year where you get put on a table with different people at the summit and you work on addressing a problem. So our issue was we're working at the story of a young man who was in college, who was a football player, and he was on pain medication. And so we're thinking of both digital and personal interventions to help him manage his pain medicine and pain itself. And also, the best part about the DHIT Summit is networking and making lifelong connections. Working with the summit and getting more involved in the last 2 years working with DHIT, I've been able to contribute to the white papers from 2018 to 2019. And to the left, you'll see the cover of the 2019 white paper. And since the springtime of last year, I got to participate in the sponsorship efforts for the summit. And when you go to these types of events, you're not always thinking about, wow, how are all these people coming together? Where did these sponsorships come from? And really getting to work with those types of efforts was really unique and special to me because there was a lot of research, outreach, and communication that was involved that you don't always think about. And then on the day of, since it was a small team, we all worked together with the help of fellows and interns and spouses and everyone to really make sure that the day ran smoothly and what really did go perfectly. And as well, also another responsibility of being involved in the DHIT Summit was really to engage in the ecosystem. People were coming from all across the country and Canada, and to make them feel welcome and engage with them and see what really brought them to the summit was an important element of the day. This year for the DHIT Summit, I got to focus on the community pitch for my white paper contribution. The community pitch was between our president, Michael Levy, and Todd Telemeco, who's the founding dean of the College of Health Sciences at UNC Pembroke. And I also had the opportunity to speak with him after the fireside chat and have lunch with him, and he really is an amazing man. His commute is from outside of the Pembroke area, and he drives an hour to get to UNC Pembroke. And through his drive, he really notices how there's a lot of health disparities and limited resources. And in that hour drive, he sees a vast difference when he gets into the Eastern Carolina area. And so Michael and Todd talked about the need for a cultural shift to adapt to the digital transformation. And this cultural shift is going to happen in the workplace, and how we train employees and students, and the skills that are covered in school and in training, because they're going to really determine how successful digital transformation is. If we send people out into the industry who are not prepared for the digital transformation, it's not going to succeed with all the potential that it has already. And so the goal is to educate both students and the current workforce so they can understand technology better, because when people leave these communities in rural and underserved areas, sometimes they don't come back to their communities. And having the concept of returning to your community and to utilize technology in a way that aligns with the community's value is really important. And who better will to know rather than someone in the community themselves is how this technology can really play a role. So the defined value in the digital age will be based on the trust of individuals and their communities, because oftentimes when we are working technology and thinking about all the advancements we can make with healthcare, we're not always thinking about the perception of other communities. We're thinking, okay, we're in Chapel Hill. This is very innovative. This is great. We can really integrate it into our system. But that works for us because we're in such an advanced academic area. But when we go out to other areas of North Carolina that are underserved and rural, it's a totally different perception. So gaining their trust is the best way to incorporate these technologies into their communities. And so the Discover First mentality, we're able to do that more successfully because we're really understanding what their perception is. We're not thinking in our heads, we're thinking in their heads and working with them together. And so then that brings the start small and grow bigger, because we can look at an underserved community and see that there's an opioid crisis, there's a lot of diabetes, there's food deserts. We can see all those issues and try to address them all at once, or we can slow down and focus in on one area and really connect with the community. And from there, we can grow bigger and make a bigger impact. And so from there, we go to DHIT's latest venture, which is the Community Health Utility Grid, also known as the HUG. And in this infographic, you can see the Give Your Community a Hug. And so the Community Health Utility Grid utilizes cloud technology, health informatics, and storytelling to understand the social determinants of health for individuals within targeted communities. The HUG will collect both communal and health-related data covering demographic, environmental, socioeconomic, and psychographic data to bring together and bring all those different data pieces together to create a bigger picture and bring in more direct impacts to the community. So the community partners for the HUG involve the College of Health Sciences from UNC Pembroke, the Duke Center for Applied Genomics and Precision Medicine, and 3 counties in the southeastern part of North Carolina, Robeson, Scotland, and Cumberland County. So the overview for my involvement in the HUG was to do a data-driven community impact analysis and community discovery. And the objectives of these tasks were to identify health-related gaps in available resources in the community, because just because we see that there are health disparities doesn't mean that there are not available resources. Sometimes it takes identifying both to bring these both to bring the gaps and resources together to be more successful. And also to learn about the current state of the community and how the needs are being addressed, because there might be a certain current state of the community, but there's a future goal. And so seeing how they're trying to address it is really important. So for the first part was a data-driven community impact. And the background of that is the social determinants of health. This is a broader image of what DHIT really focused on for addressing the social determinants of health. But the social determinants of health is this idea that there are many factors that feed into an individual's overall health. There's individual behavior, social circumstances, genetics and biology, medical care, and environment. And within each category, it goes way deeper, and there's many levels to address these different areas. And so together when we're using the data utility grid, it brings together all these different areas to really address the health issues in the communities for individuals. Excuse me. So for the data-driven community impact, I collected data from the North Carolina Institute of Medicine's website. And on their website, they have the North Carolina County Health Profiles. And they have these health profiles for every single county in the state that has demographic, access to care, and health status and determinants of health data available. And here are my findings. So I got the 3 counties, Cumberland, Robeson, and Scotland County data, and compared it to the rest of the state. And highlighted is where there are disparities within the counties compared to the rest of the state. And as you can see, that there are a lot. You can see that there's lower graduation rates, there is lower reading proficiency, there's more uninsured adults, there's obesity, and so forth. And as a data analyst, you can look at this and say, okay, we have an opioid problem, we have a diabetes problem, we have a cancer problem, we have heart disease problems. Let's create these interventions and bring them into the community. But looking at these numbers as a data analyst is different than looking at these numbers as a member within the community. These numbers might mean something different to a community member rather than an expert. And so that brings us to the community discovery element of the project. So with over 17,000 public libraries in the United States, with collectively supporting 4 million visits a day, there is a big opportunity for these areas to be access points for information. So with healthcare and health information being more accessible than ever, public libraries are an opportunity for public health outreach because not everyone has access to information within their own homes. A lot of people do depend on the public library to get on a computer, to pay their bills, to do their homework, and to access their health records. And some public libraries already serve as an access point for their communities for health information, healthcare services, and connections to health services themselves. And so for the focus of the community discovery, we identified all the public libraries in the state of North Carolina by county. And then next, with the focus counties of Cumberland, Scotland, and Robeson, I read about the available resources provided by the libraries to address digital health. And so some of the libraries did already have digital health and digital literacy courses, but not all of them had those types of resources. And so the next step was to figure out and get in contact with the leaders and stakeholders at the county's public libraries. And through many emails, phone calls, and voicemails, I was finally able to engage with librarians at the public libraries. And although the focus was on Cumberland, Robeson, and Scotland counties, I did statewide just to really gain a better idea of what is going on in the state of North Carolina. Through the community discovery, I found that there is a demand for digital health resources. The libraries that already have the classes, they want more, they want to enhance and become more advanced, and they also want all the other libraries on their system to get to their level, because in a library system, maybe one library will provide digital health courses and assistance, but not every library does that. And so they want to really expand these resources across all the libraries. And through these conversations, I learned that the public libraries are really an access point for a lot of people in the community. They're busy throughout the whole entire day, and people are there taking care of a lot of their own personal business. And the librarians also shared with me their pain points and available resources, and they're really happy to share what the problems were, but they're also really proud to share what they are already doing. And when I explained to them the community discovery I was doing, they were interested in hosting their own community discovery sessions at their libraries because they thought it was a really good exercise. So through one conversation I had with a librarian in Western North Carolina, it was one of the most impactful conversations I had in this whole process, because when she left for work and went home, she still knew that she was serving her constituents at her library, because in Western North Carolina, not everyone has internet access or Wi-Fi in their homes. And so for people who are working during the day and can't go to the public library at night because it's closed and they can't access the internet at night, the library boosted their Wi-Fi signal 24/7 And so she knew at the end of the day, when she was home, there were people in the parking lot at her library sitting on their laptops and phones just to access the internet so they could pay their bills, apply for jobs, apply for school, help their kids with their homework, and so forth. And so really the outcomes of it was really to learn that it's really different from library to library, but there is overall interest in getting digital health resources at the libraries because there are a lot of health disparities that they're aware of, and these librarians really want to serve their communities. And so in conclusion, there is a need for digital health interventions in these communities, and public libraries are a great access point for information and education. They have a full staff who is really passionate to help their constituents and their communities, which is really reassuring to hear. And that also stakeholders and leaders want to get together to address these issues. Stakeholders from across, from healthcare systems to county officials, they really do want to come together and work together as a team to help their communities become healthier and stronger. And most importantly, creating the connections and learning to empathize with these communities is the key to success for tools like the health utility grid. Because if we were to come into a community without understanding anything that was going on, without talking to leaders and stakeholders and really engaging with them, these types of efforts won't be as successful unless you really empathize with them and really understand where they're coming from. And so the lessons learned from this project and overall my whole internship is that it is a challenge to coordinate with multiple stakeholders because people really did want to be involved, and then they want a coworker to be involved, and getting times and dates together is really challenging. And so although we did try to host a community discovery session, it was not able to work out while I was working on the project, but we did lay the groundwork for it to be successful in the future. And next, working with a young startup organization was an amazing experience, and I don't think I would have had the chance to do so unless it was for this internship. And working with a startup organization, you have to be agile, flexible, and adaptive because things change day to day in really good ways, and there's always opportunities that you need to go for, and sometimes you're working on a project, but you might need to pause and work on something else because something came up, and learn to be flexible and really be a part of the team is a really important thing that I learned. And so one of the biggest takeaways I got from DHIT is the importance of being able to communicate data to create a positive impact. Because as someone who's been in the data analytics for about 6 years, it is so crucial to produce clean, accurate, and well done data. But to be able to present that data, make it understood by other people who are not data analysts, for instance, is really important because not everyone understands a curve, not everyone understands a p-value. So if you're able to communicate data in a people-centric way, you're going to create a positive impact and get through to more people. And so with a foundation built on empathy, you can drive change through a story. And I really do believe in that. After the community discovery, I learned a lot more, and I was able to hone into my own skills to see how I could help people in these areas better than I could before. So with that, I'd like to thank the DHIT crew for everything. They were all great mentors and really taught me a lot. They always took me to meetings, introduced me to people, and kept me involved and kept me busy, and I was really happy to work with them for my master's internship. And most of all, I'd like to thank the Carolina Health Informatics Program, Dr. Mustafa, Saif, and Mariel. Thank you all so much for your leadership and advice throughout the process and really letting me create my own path and run down it. And I really appreciate it for it, and I'm really proud to be a part of the program. Thank you.